Hi, my name is Lee Jones. I'm the Principal Healthcare Science Practitioner at Clinical Engineering. However, I lead a team of engineers and technicians to cover medical device maintenance at Prince Philip Hospital and the community. In the reserves, I am a Petty Officer, Engineering Technician, Weapons. I did 15 years regular service. After 15 years service, I joined the reserves, the same time I joined the NHS 8 years ago. I really enjoy working for Cwrdd in a role that brings up daily challenges, daily different pressures. I get to meet lots of different people working in different professions across the health board, and myself and my team try our best and work as professionally as we can and as efficiently as we can to minimise the disruption in clinical service with regards to medical device maintenance and repair. I really enjoy being a volunteer reservist because it allows me to utilise my skills from regular service and utilise skills that I've picked up in the NHS over the last 8 years to support various ships within the weapon engineering departments or marine engineering departments on various platforms within the Royal Navy. I've had an excellent support from Cwrdd over the last 8 years and my management to fulfil my reserve career and being able to leave my current role and be welcomed back into my current role after I've done my time away. I'm currently away at the moment supporting HMS Scott. They are currently in a maintenance period at Falmouth. So I'm down here for the next 2 weeks supporting them and to prepare them for their forthcoming deployment overseas at the end of June. I'd like to thank Cwrdd for helping me and supporting me in my role. I'd like to wish all my fellow reservists in Cwrdd a happy Armed Forces Day, and hopefully we can catch up soon in person.